diabetes insipidus is actually not one thing. There's three things that happen, right? It's due to water balance. So there's a water balance issue. Why do we have water balance issue? It's because of either there's no or ineffective ADH, right? Anti-diuretic hormone. So, or it can be resistant. So either ineffective, no, or resistant ADH. Basically, you're not responding to it. Remember, ADH, which is anti-diuretic hormone, is anti-diuretic. So against diuresis, right? It does not want you to really um, have a urine output, like urinate. So it's against diuresis. So if you don't have it, you're going to have a lot of diuresis. That's the way you can think about it. So you have excess um, loss of water. But this is coming from your brain. Most of the time from the brain, from the pituitary, right? It's from the pituitary gland. That is where it's secreted. And we secrete it based on our water balance. So if your blood concentration is too high or low, your body will try to secrete these hormones. Do the same thing, either whichever the situation is. So this is the way you can think about it. Water balance issue, whether it's effective or ineffective, or your body is not responding to it. That is the idea. So when your concentration of your blood is high, your body releases a lot of ADH so that you can absorb water to decrease it. If the concentration is too low, we don't absorb any water and get rid of the water and bring it normal. Okay. The problem is there's three types. Like I said, there's three types of ADH. It can be central. So if you see a question, don't worry about it. Just based on the first thing they put in central, which is this is neurogenic. Okay, neurogenic cause of diabetes insipidus or nephrogenic. That means it's from your kidney, right? Or is you. We call it dysprogenic, and I will explain it to you later on. So dysprogenic. What does that mean to have a neurogenic cause? Neurogenic cause means your brain damage. So neurogenic. It's the brain that is the problem. Neurogenic. That means brain trauma or you have surgery. Sometimes it may be because you have a tumor, or sometimes we don't know, idiopathic, right? And so when the brain gets damaged, usually the pituitary ADH is not secreted from the pituitary gland. So this is the problem is you don't have ADH because so lack of secretion, lack of it because your brain cannot secrete it. And this is the key thing about neurogenic. If it's nephrogenic, so this is the how you can master them, right? Nephrogenic. When you see the question is nephrogenic, it means your kidney um, does not recognize ADH. That means you have it, but your kidney cannot see it. Most of the time, it's medication. Number one medication that causes this is lithium. Lithium is very smart. That's why it causes dehydration. It's because it makes you not see ADH. So lithium is number one cause of nephrogenic diabetes insipidus. Patient who is on lithium would develop DI because not because they don't have ADH, but they have it, but they cannot recognize it. So the ADH doesn't do anything. Or if I give you this medication, democlocycline, this is why we use it. It's antibiotic. We use it to treat patients who have SIDH, right? They have SIDH. They have too much ADH. If I give you democlocycline, it will destroy, basically, it will prevent the SIDH from manifesting itself. So we block ADH. That's the problem. As democlocycline block ADH. If you have lithium, it's going to stop ADH from working. Your kidney cannot see it, and you develop nephrogenic diabetes insipidus. The third one, you may have heard about it, but this is usually common in patients who have psychotic problem. This is classic. People who have psychotic problem, we call it dysprogenic. And there's a damage, right? There's a damage to their test center in your brain. There's a reason why these people drink a lot of water, right? The third center in their brain is damaged, usually psych illness, and therefore they drink too much. And when you drink too much, a big excess fluid intake, it suppresses ADH. So this is what happened to them. So you have to know the difference: neurogenic, nephrogenic, and then a dysprogenic. That means um, your brain is basically test center is being destroyed because you drink too much and you have psychotic problem. Second, you have to know how to treat these patients, but you have to also have to know what kind of features you're going to see. So what do you see when a patient has basically DI? In all of them, the signs and symptoms is what your board like, signs and symptoms, right? They're going to be testy because they've been drinking a lot of water and then they lose all the fluid. So first one is polyuria, right? They're going to pee a lot and then they will be testy, right? Polydipsia. So it look like somebody who have diabetes, but it's DI or something like that, but it's not. This is due to the brain injury. And then they will have dehydration. If you pee too much, you develop dehydration, right? If you have dehydration, what? Hypotension. That's what happened. If you're hypotensive, what happened? Tachycardia. You see what I'm doing? I'm trying to deduce information from the content. So you should do that when you're taking, when you're studying. You don't memorize signs and symptoms, but you can make it up. If you have polyuria, you pee too much, you get thirsty, polydipsia. If you get thirsty and you try to drink and pee, you get dehydrated. Dehydration, you become hypotensive. Hypotensive, you develop tachycardia. What happened? You have dry mucous memory, right? And then you get fatigue. Do you have to memorize these signs and symptoms? No, this is what you expect. And if you get fatigue, you get dehydrated, you get confusion due to what happened to all the signs and symptoms associated, all come together and it develop that. What your body will ask you is this. Also, don't forget this lab work. What should you expect? Don't memorize it. This is a select or apply, so don't memorize it. Like I told you, we have a certain concentration in our blood. We have a certain concentration in our urine. But when you have DI, it changes. Remember, diabetes insipidus, you're losing water. So if you lose too much water, what happened to your blood concentration? What do you think? If you lose too much water, your blood will become concentrated. So we call it blood. Blood is the osmolarity. So blood osmolarity is going to be high. So you get elevated. Whenever blood osmolarity is high, sodium go the same direction. So you don't have to memorize. So your sodium, so blood sodium, serum osmolarity, serum sodium also goes high. It follow the same direction. So this become high. If the blood is concentrated and you pee a lot, your urine become what? Dilute. So your urine osmolarity, which is the same as specific gravity, is going to go what? Down, low. And your urine sodium, okay, also go low. This is a select and apply. You should not mix. It's a free answer choice. You should never forget it. If they give you numbers, it's easy. Your urine specific gravity, this is the normal, 1.003, and flip the zero back, 1.030. So If your urine specific gravity is low, it should be less than 1.003. If it's high, it should be greater than 1.030. That's all. That's the key aspect you have to know. These are the way they will confuse you. Now, treatment. How do you treat it? Think about what I said. In treatment, so let me put it here. The treatment number one is nephrogenic. Let's start with neurogenic. Neurogenic, that is what they will use the word central. Central is every central DI. That's what everybody know. Everybody know about central. Central means your body, your brain is not making ADH. Therefore, if he's not making it, the treatment is to give the individual ADH. That's number one. Okay. Number one is give them the ADH. We don't have any ADH, so we give you desmopressin or vasopressin. And since you very dehydrated and your urine sodium, your blood is very concentrated, we give you hypotonic solution. That's all, right? And you let them drink. So hypotonic solution, let them drink. But this is the key treatment you have to know. And desmopressin, give them IV fluid and monitor their virus. If it's nephrogenic, is the kidney, right? Nephrogenic is because you're taking certain medication like lithium or you're taking desmoclocycline. Stop the desmoclocycline. That's all. Or if it's lithium, stop the lithium. But if you cannot stop the lithium, there's a medication you can give. This is thiazide. Don't forget, thiazide is the number one medication for the treatment of nephrogenic diabetes. It prevents loss of fluid, even though it's a diuretic, it's a different way. It acts a certain way when you have nephrogenic diabetes insipidus, and that helps with the situation. If it's dysprogenic, that means psychotic problem, then all you need to do is to prevent them fluid restriction. That's all. If they drink too much, don't drink too much. And this is the key how to know the difference between all of them. Don't forget, this is a brief information, but this is all you need. You don't need anything to understand the difference between each level of diabetes insipidus, and then how to recognize which one is nephrogenic, which one is central, and which one is dysprogenic. There's something you have to know, right? If it's central, okay, and I deprive you from drinking anything, it's still not going to solve the thing because you don't have ADH. That's the thing. Remember, if it's nephrogenic, if I give you desmopressin, it's not going to work. Those two things, don't forget. Fluid restriction does not solve central. That means your brain cannot make ADH. So it's only for dysprogenic, right? And then desmopressin does not solve nephrogenic kidney problem. Therefore, because the kidney does not recognize it, so if you give them ADH, they're still not going to work. It works for central. In all, nursing care is the same, right? Nursing care is the same. You have to do certain things as a nurse. First, monitor, right? INO. You got to check their vitals, right? Right? Watch for signs of dehydration, right? Replace the electrolytes, and then you have to give them hypotonic fluid to bring their sodium down, right? You got to educate them about medication. These are all nursing care for all of them. It's very, very important. And then you got to monitor their mental status. Why, guys? Why mental status is number one? This is number one. When somebody has diabetes insipidus and you're treating them with the desmopressin or you're taking care of them, you have to monitor them. After you treating them, you're giving them desmopressin or doing everything, you have to monitor their mental status because now what is going to happen to them? You have to monitor their mental status because they will turn into SIDH. When you're giving them too much and ADH, they will turn into SIDH and their sodium become what? Hypotonic, very low, low sodium, hyponatremia, and then they go into seizures. That's why mental status is very important. You want to somebody asks what kind of hypotonic solution? Any hypotonic solution. You can give them free water or half normal saline. Don't give them 3%. 3% is used for SIDH. So hypotonic solution is what? Free it's for central. For central. These treatment you can give them D5W water. It's just free water to dilute the sodium that is already high. Remember, their specific gravity is high and their serum sodium is high. So you give them free water, which is D5W, or you give them half normal, so 0.45% of normal saline. That's what you give them. Don't give them normal saline. If you choose normal saline, is a wrong answer. If you choose 3%, is a wrong answer. That is for SIDH. But this is a brief, very high yield information regarding management of diabetes insipidus. It's not only one. So if you see a question, if you've seen a question before and they said central, they said nephrogenic, they mean something. They're trying to tell you it's not the normal SID, no, DI, but this is the different, and their management is different. Remember, central, you need desmopressin. That's the priority. If you're nephrogenic, give them thiazide or stop the medication causing that dysprogenic fluid restriction. This is a brief high yield content regarding diabetes insipidus.